My name is Hannu Kuokkanen. I'm the head of Division of Plastic Surgery in Helsinki University Hospital. And I've been with the team of when we developed the wound center of Helsinki University Hospital for a few years.
My name is Kirsi Isoherranen. I live in Finland, Helsinki. I'm a dermatologist and a dermatosurgeon, and I work in Helsinki University Central Hospital and Helsinki Wound Center.
Chronic wound is an international major problem because the incidence of wounds gets bigger and bigger because of the medium age of population gets higher, the obesity, diabetes gets higher, so we get more and more chronic wounds, and we really have to work with them very efficiently in order to keep the thing in control.
I think in Finland there is a good tradition in wound management in general. It started in the 1990s, and we have really high-trained tissue viability nurses, and nowadays we have also more and more physicians interested in wound healing.
Management of chronic wound patients has been not very good lately so far in our country and in the Western world, because we don't have flowing treatment chains from the general practitioners to the special health care. We have a separate system for general practitioners, and we have a certain cutoff in between, and we really work hard to get these treatment chains to be more fluent and to organize the treatment of chronic wound patients, that everybody in all the steps would know what to do and would blow on the same direction. And the biggest thing is to put effort on making the wounds not to come, so the prophylaxis, that's the big thing, and then early treatment, early intervention if we have a problem. And then if the patient don't heal with these measures, so we should have a straight line to the special centers for consultation, possible operation, and then after that smooth path to the post-operative care. So with that measures we can treat this big population more effectively than what we have done. To practice the good clinical care on European guidelines, it's not at all easy. In reality, those rules are not very complicated. They are easy to understand. But to put in the practice from the general practitioner line for the patient information and all the steps of treatment, so it needs a lot of information, education, cooperation, communication, which really needs a lot of resources and change of the culture in the treatment chains.
In special care we know the European guidelines very well, and usually the barriers I think are between primary care and special care, and that's our challenge to implement the guidelines also to the primary care, because in the Finnish health system the wound patients first go to the primary care, and sometimes there can be delay for diagnosis or delay in referral to special care.
The strongest barriers on implementing the European guidelines so far has been more or less administrational. So we have separate systems in general practitioners and for specialist care. So we are just about to change the law in Finland that we have the same administrational background for all treatments, so it makes it easier. But we have fighted against this barrier in our new wound center, so we really focus on the cooperation with all the steps on treatment. And we have been succeeding to start with quite nicely, and we hope to get it much better in the future. To implement the efficacy and then the quality of wound care needs mostly communication and generally agreed ways how to treat the patients and open information channels. So in my opinion we have quite a lot of resources in our healthcare, but we should work more efficiently together and do cooperation openly so everybody would know what the others are doing.